people. So today we'll be talking about fallopian tube blockage, and let's just break it down. What is fallopian tube? These are like the tiny pathway that transports the egg from the ovary to the uterus, that is the womb. It also serves as a pathway for the sperm to swim to the egg for fertilization after ejaculation. So, what causes this blockage? Sometimes, most times, it is caused by PID, that is the pelvic inflammatory disease. So, this happens when this pathway is obstructed by scars. You know, when this pathway is inflamed, it begins to build up some scars and will eventually lead to obstruction of these tubes. So when this happens, there can be fertilization because the egg cannot be released into the uterus and the sperm cannot swim to the egg for fertilization. That is where infertility comes in, lingered conception. A lot of people, doctors, health practitioners will tell you that there is no natural solution to this apart from clinically removing these tubes, that is surgery. Or they might tell you that you cannot even conceive naturally unless through IVF. So these are lies. It's because there are some ways this could be corrected. And if you're having such problem, you can send a DM for guidance, for consultation. I'll put you through that. So a lot of people will ask, what are the signs of tuber blockage? Most time, people don't even know that their tubes are blocked until they start trying to conceive. Just few people might just experience pelvic pain. You start feeling pain on their pelvis. So, and there are some people that maybe it's just one of their tube that got blocked, or probably the two of the tube that got blocked. When it's one, it's unilateral. When it's two, it's bilateral. The best way to know if your tube is blocked or not is to go for a test called the HSG. The HSG test will determine if your tube is blocked, the degree of it being blocked, if it's just one or two of the tubes that got blocked. So that's just it. You can still conceive with your tube being blocked. That is, it is just one tube that got blocked. You can conceive with the other tube. If both tubes are blocked, you have to get a treatment for it ASAP. You have to get a treatment so that, because the earlier the best, if you keep delaying it to get to a point that this inflammation will just rip off that tube, because this are scars, it keeps building up, and to a certain level it's going to be damaged entirely.